Do you sometimes feel so frozen with fear you can't move or talk, even when someone asks you a simple question? Or maybe you've seen someone stare blankly, not respond, and stay in one position for hours. That could be a sign of catatonia. It's not a disease on its own, but a serious condition that often shows up with other mental disorders, like schizophrenia, severe depression, or bipolar disorder. Think of it like a mental freeze mode. Your body and mind get stuck, even if you want to move or speak. This isn't laziness or being dramatic. It's real and can be really scary for you and people around you. Have you ever felt trapped inside your own body? So what causes this freeze mode? Imagine your brain is like a busy train station, with signals moving between tracks. In catatonia, the signals get jammed. It usually happens because of another mental health problem. For example, someone with schizophrenia might stop responding to people, or someone with major depression might lie still for days. It's like their brain, S-on button, stops working. Sometimes, medicines like antipsychotics can cause it, or even sudden withdrawal from certain drugs. Other times, physical problems like brain infections or seizures trigger it. But the biggest causes are mental health issues. Have you or someone you know been struggling with depression and then suddenly stopped moving or talking? That might not just be sadness, it could be catatonia. What does catatonia actually look like? Let's play a short spot the symptom game. Option A, a person stands in one spot for 3 hours, not talking, not moving like a statue. Option B, someone repeats the same word over and over, even if you ask a different question. Option C, a person copies your every move, like a mirror. All three are signs of catatonia. Other signs include refusing to eat, grimacing for no reason, or suddenly moving wildly. Some people with catatonia can't speak at all, called mutism, while others echo what you say. It's not always being still. Sometimes it's the opposite, uncontrolled movements. It's confusing, right? That's why it's important to understand the range of symptoms. How do doctors know it's catatonia? Simple, they watch and ask questions. There's a test called the Bush-Francis Catatonia Rating Scale, where doctors check for things like staring, rigidity, or echoing words. If someone shows 2 or more signs, catatonia is likely. The cool part, it can often be treated fast. The most common treatment is a medicine called lorazepam, a calming pill. Many people start moving and speaking within minutes. If that doesn't work, a treatment called ECT, electroconvulsive therapy, can help. It uses gentle electrical pulses to reset brain activity. Yes, it sounds intense, but it's safe and can be life-saving. Would you believe me if I said someone woke up from a 3-week unresponsive state after one ECT session? It happens. Can we stop catatonia before it starts? Not perfectly, but yes, we can reduce the risk. The key is managing the mental health condition that causes it. For example, if someone has bipolar disorder, taking their medicine regularly helps. If you feel depression getting worse, if you're not eating, not moving much, tell someone fast. Early help can stop catatonia from forming. Therapy, medicine, and support from family help a lot. Think of it like wearing a seatbelt. You hope you won't need it, but it protects you if there's a crash. Are you checking in on your loved ones? Sometimes just talking can prevent a crisis. Scientists are learning more every. One recent discovery is that catatonia might be linked to GABA, a brain chemical that helps calm down the mind. When GABA is low, the brain gets too excited and can freeze. New studies are testing drugs that boost GABA. Also, researchers are looking at how blood tests or brain scans could help diagnose catatonia faster. Some hospitals now use screening tools for all patients with mental health issues, so catatonia isn't missed. Just a few years ago, many doctors thought it was rare. Now we know it's more common than we thought, but very treatable. The future, faster diagnosis, gentler treatments, and better awareness. Could you imagine a world where no one suffers in silence because we